Hi everyone, welcome to a new video. In this one, I'd like to discuss a little bit about inhalers prescribed in the recovery period after a chest infection. And I've received this comment on my channel. I'll read it to you in a second. So from Harris, for a cough after bronchitis, can we use Symbicort or Ultibro breathaler for relief for a month and then stop taking it? Is Ultibro breathaler as good as Symbicort? And then Harris has a similar question, well, the same question on a different video, whether in the month or 6 months after a chest infection, we can use one of these. Now, it's important here just to give you a little bit of a context. So normally after a chest infection, we can have a cough that can last for up to 6 to 8 weeks. It's called a residual cough, and it's something that's normal. Let's say it can happen in most people to have this sort of lingering cough. It can be quite annoying, but if it tends to get better slowly over time and then sort of disappears within, let's say, 2 months after a chest infection, it's probably part of the normal recovery phase after the infection. Now, on the other hand, in some patients, and we've seen this actually quite a lot during COVID, we've had people who actually have these persistent respiratory symptoms for longer. Now, that can be because the infection itself may have triggered some sort of a chronic lung condition, such as asthma. That's a possibility, although it's not usually asthma in that circumstance. It's just a lingering sort of bronchial hyperresponsiveness, we call that, and it's just something that tends to go away over time. Or, it may have reactivated an underlying disease that you didn't know about. So for example, again, talking about asthma, maybe you used to have asthma as a child, and then you had this infection that sort of activated the immune response in the airways in an exaggerated way, and then you are basically looking at a reactivation of the asthma that may have been lying dormant. So these are all possibilities. Sometimes it's just part of the recovery phase, like I said, to have these sort of chest symptoms that persist for a while. And it could be cough, it could be a wheeze that is there. So in that circumstance, sometimes patients do ask whether they can take an inhaler. Now, what inhaler should you take? First of all, that's a decision that should be done together with your doctor. I wouldn't recommend going out and taking inhalers from the pharmacy, even though I know in some countries of the world you can do that. I don't think that's the best way. I think your money is best spent going to seeing a doctor, actually, and asking for advice that's personalized in your case. And so even my video probably won't help you that much in that regard. But I'd like to just tell you the difference between these two inhalers that were mentioned in the comment. So going back to the comment for a bit, Symbicort was mentioned and Ultibro was mentioned. Now, these two inhalers are quite different. So in the case of this lingering inflammation after a chest infection, what you're trying to do with that inhaler is to inhale a medication that might control the inflammation in the airways. Now, these two act in slightly different ways. So for example, Symbicort is a combination inhaler that contains an anti-inflammatory drug, a small dose of corticosteroids, and another medication that opens up the airways. It's a bronchodilator. So it's a combination of the two. Ultibro, on the other hand, only has two medications. Well, it has two medications as well, but both of them act to open up the airways. So they work synergistically together. And you have these two in the same inhaler. So Symbicort also contains an anti-inflammatory, while this one doesn't. So basically it's a difference in mechanism of action. So depending on what you're trying to achieve after a chest infection, if you're trying to treat the inflammation, your doctor may potentially recommend taking Symbicort or some other inhaler that contains an inhaled corticosteroid to try to control that inflammation in your airways in the few months after the chest infection, especially if you're not getting any relief from the cough. That's a possibility. But they may look into other causes for the cough. So I wouldn't want you to go away from this video thinking that definitely an inhaler will help in all situations. For some patients, it really doesn't help. So it's a question of discussing whether this would be indicated in your case with your doctor. I think that's really the main thing. Why am I saying this? Because you can have that cough that's sort of maintained by other things as well. It may not be inflammation at all. You may have some acid reflux. You may have some sort of a ENT problem. You've got maybe a bit of lingering chronic rhinitis and you've got postnasal drip. There's secretions running down the back of your throat. So you may need to treat the nose rather than the chest airways with an inhaler. You may want to treat the acid reflux from your stomach. There may be different things that may be going on. It's not always the cold, the chest infection, the bronchitis that's causing this sort of ongoing struggle with the symptoms, such as cough and wheeze. There may be, like I said before, a condition that hasn't been diagnosed and it's just been revealed by this chest infection. So it's quite important to just look at all these things together with your doctor and make the best decision in your case. But in some instances, yes, taking an inhaler after a chest infection may help reduce symptoms. But don't forget that a residual cough after a chest infection can last for up to 2 months. If it lasts longer than that, by all means, I think you should consider seeing your doctor to see what's going on. And if you have any symptom, basically, that is worrying you, if your symptoms are getting worse after your initial recovery, definitely go see your doctor. Hope this was helpful, and I'll see you in future videos. All the best and good health to you.